Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to provide you with updated information regarding COVID-19. In North Carolina, the state reports 29,263 cases of COVID-19 in 100 counties. There have been 898 fatalities in North Carolina associated with COVID-19. Currently, there are 650 hospitalizations across the state from COVID-19 illness. The state updates this information and more regarding COVID-19 daily on their website at ncdhhs.gov. The number of positive COVID-19 tests in Dare County is now 23. The newest positive test result is of a non-resident who acquired the virus from direct contact with a family member. The individual is asymptomatic and is isolating in their home county. In this particular case, the individual returned to their home county prior to us receiving the test results. Upon receiving the positive result, we notified the individual's home county health department and worked closely with that department and the individual who tested positive to ensure all direct contacts in Dare County were identified and notified. To help the public maintain an accurate understanding of the positive cases in Dare County, we have revamped the data dashboard on the Dare County website to provide more detailed information. The new dashboard breaks down the total number of positive tests by residents and non-residents and provides overall demographic information regarding gender and age. The resident and non-resident data is further broken down to include information on current case status. Of the 23 individuals who tested positive for COVID-19 in Dare County, 18 are residents and 5 are non-residents. Of the 18 residents, 15 have recovered or are asymptomatically cleared, 1 has died, and 2 remain active. The 2 active cases have been active for over 3 weeks. These 2 cases are not connected and the individuals are very different. One individual is over 65 and considered high risk, and the other individual is middle-aged with no underlying medical conditions. These 2 cases speak to the remarkable nature of this virus and how it affects individuals so differently. Both of these individuals have been retested recently, and while it has been over 3 weeks since exposure, both still tested positive and remain in isolation, one in the hospital and one at home. We will continue to update the Dare County COVID-19 positive case data daily. For the most up-to-date information on COVID-19 cases in Dare County, visit darenc.com/COVID19. While we are fortunate that the number of positive tests for COVID-19 in Dare County has not increased significantly over the past few weeks, I want to stress that this does not mean that we should let our guard down or that we should believe the virus is not in our community. As restrictions have been relaxed, there are more people interacting with one another and with members outside of their family unit. Travel has increased, and as people come and go, we may not be made aware of individuals who are positive for COVID-19 if they are tested outside of Dare County and don't have a Dare County permanent address. Anytime we are notified, however, we will immediately conduct contact tracing to help reduce the spread of the virus. Please remain mindful that some individuals who may have COVID-19 may not be aware, as they may be asymptomatic. It is critically important that we all practice the 3 W's to protect ourselves, our families, and our community. The 3 W's are wear, wait, and wash. Wear a cloth face covering if you will be with other people. Wait 6 feet apart and avoid close contact. And wash your hands often with soap and water for at least 20 seconds or use hand sanitizer. I will now provide trend updates on the 4 key metrics we are tracking as part of our disease investigation and surveillance. This trend data provides information on the intensity and spread of COVID-19 in our community. Because data has limitations, no one metric should be viewed in isolation. The 4 key metrics we are tracking are weekly number of tests, laboratory confirmed cases, positive tests as a % of total test, and COVID-like illness surveillance. We will continue to update the data for each of these key metrics on a weekly basis and share this information in Tuesday videos. The weekly number of tests. This graph shows the number of tests being reported in weekly increments. 1,021 COVID-19 tests have been reported to Dare County through May 31st, 2020. The number of tests continues to increase over time. 301 tests were reported this past week, including 179 tests conducted during the drive-through testing event on May 26th. While we had offered 200 appointments for the drive-through clinic on May 26, we had a number of no-shows, so only 179 tests were performed. Of those, 177 were negative, and 2 were deemed invalid due to insufficient specimens. Today, we will host the second drive-through collection event to test for COVID-19 in Dare County. Appointments are still available for this event, but you must call by 12 noon today for an appointment. You may schedule an appointment for today's testing event by calling 252-475-5008. Results from today's testing will be available by this coming Friday, June 5th, and any individual who is tested will receive a phone call from the health department to notify them of their results. We do not have another drive-through testing event scheduled at this time. However, the Outer Banks Urgent Cares in Kitty Hawk and Nags Head are now offering COVID-19 diagnostic testing for anyone who feels they need to be tested, regardless of symptoms. Please call ahead if you would like to schedule an appointment for testing. Additionally, Beach Medical and Surf Pediatrics and Medicine offers COVID-19 testing. For more information on testing availability, please visit darenc.com/COVID-19. The second metric is laboratory confirmed cases. This graph shows the laboratory confirmed cases by date. Dare County had 1 positive test this week, as mentioned earlier. Positive test as a percent of total test. The number of COVID-19 tests being reported has been increasing over time in Dare County. The percent of positive tests to total test in Dare County has been decreasing for the past several weeks. This week, our overall percentage decreased to 2.25%, since more tests were performed, yet there was only 1 positive case. The Dare County average percent of positive test results to total tests since March 9th is 4.37%. And the fourth metric is COVID-like illness surveillance. In North Carolina, we receive emergency department data in near real time using the North Carolina Disease Event Tracking and Epidemiologic Collection Tool, or NC Detect. This is an effective way to track respiratory illness, including COVID-19. As you can see from this graph, the percent of emergency department visits with COVID-19 related symptoms remained very low this week, with no more than 5% of patients presenting to the ED with COVID-19-like symptoms on any given day. Since this data only represents people seeking care in the emergency department, we remain in close communication with the local urgent care centers and are working with them on syndromic surveillance as well. While the number of individuals seeking medical care at the urgent care centers increased over the past week, only a small percentage of patients sought care related to COVID-19 symptoms. As we continue to move through the weeks and months ahead, please help us spread facts, not fear. We encourage you to stay informed by visiting darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center, open Monday through Friday from 8:30 a.m. to 5 p.m. at 252-475-5008. Thank you.